Hi, my name is Lisa Abed, and my article is called Enabling Good End of Life Care for Dementia Patients. Dementia of all long-term illnesses accounts for the greatest chronic disease burden, and the number of people with age-related diseases like dementia is predicted to double by 2040. People with advanced dementia experience similar symptoms to those dying with cancer, yet professional carers find prognostication difficult and struggle to meet palliative needs. The physical symptoms undetected and untreated, while the elements of good practice in the area have been identified in theory. The factors which enable such good practice be implemented in real-world practice need to be better understood. This was a 5-year study, and 30 experts in dementia and/or palliative care were interviewed. The purpose of this article was to establish best models for quality of end-of-life care for patients with dementia. The elements of good practice discussed by experts, it came clear that knowing the person with dementia, interpreting nonverbal communication, listening and respecting family carers, and ensuring personal and physical comfort were recognized as important. Knowing the person with dementia involved understanding their wishes and preferences and judging how and when to talk about the dying with them. Knowing the person could be supportive by ensuring continuing of care. Being able to interpret nonverbal communication was also viewed as an essential element of good practice, involving recognizing the meaning of facial expressions, the meaning of sounds, and realizing the signs of agitation may have underlying causes. Listening to and respecting family carers was discussed in terms of building on the existing knowledge of family members, including contributing to the interpretation of communication and providing insights to a person's life history, supporting existing relationships, providing post-bereavement support, and managing the transition to sharing of care with staff, ensuring personal and physical comfort involved addressing symptoms in a proportionate manner, identifying and treating pain and the features of comfort. For example, a familiar, calming environment and appropriate room temperatures, and the knowledge of what comfort looks like for that particular person are prioritized. While this analysis contributes to understanding the elements of good practice, this article also discussed the factors on which enables good practice to happen. It was apparent that these factors have significant implications for the performance of good practice. This became the focus of further analysis. The aim was to produce a focused account for factors experts considered crucial to good practice, based on additional analysis. The following factors were important implications for good practice in the end-of-life care with dementia. Leadership and management of care. Managers and administrators need to equip frontline staff with tools and procedures and appropriately train them for end-of-life care. Despite the number of barriers within care home settings, such as low wages for the care staff, high staff turnover, and an appropriate number of qualified staff, most experts recognize that the leadership and management in care homes with staff support and working examples of good practice was crucial for the good quality of care. This area of practice, however, needed to be complemented by appropriate integration of clinical expertise in palliative care. Integrating clinical experience in palliative care into routine settings can play a great role in managing some of the physical causes of distress. Also, into the integrating palliative care into the usual care team, for example, where a nurse specialist in palliative care visits the home, can help ensure the person with dementia enjoy continuing of care. Lastly, ensuring continuing of care. One of the main advantages of having continuing care is the staff that can develop their own knowledge of a particular person, including routines, history, preferences, relationships. Ideally, before the onset of advanced dementia makes verbal communication difficult. There are also recognition that it may be unavoidable that staff with dementia will move between different key professionals. Continuing care should follow a person with dementia and their family despite the problems associated with funding and insurances. This causes an issue and having their care being disruptive. Therefore, a better need for integration needs to be implemented for quality of care. In conclusion, 4 key factors influencing good practice in the end-of-life care for people with dementia were identified from the experts' interviews: leadership, management care, integrating clinical expertise, and continuing care. The relationships between these key factors are important. Leadership and management of care have implications for successful implementation of guidelines, while the appropriate and timely use of clinical expertise could prevent hospitalization and ensure continuing of care. A lack of integration across the health and social care can undermine continuing of care. Further work is needed to understand how existing guidelines and tools contribute to good practice. This is a list of resources that can provide more information regarding dementia and enabling good end of care for people with dementia. Thank you.